Hi guys, this is Medical Science Lecture Room. I am very happy to have you here. Today, I would like to share with you on the topic medication abortion or medical method of abortion. Just to inform you, in this channel, I give medical tips or medical education to my esteemed viewers at the comfort of their living room. Again, we run classes for students of physics, chemistry, and mathematics. In case you are new to this channel, please hit the subscription button, turn on your notification bell so that you will not miss out from any of our videos. Like this video, share it if you find value. Let's begin. Welcome back. Like I told you today, I would like to discuss or share with you on medication abortion, or what we call medical method of abortion. But quickly, what is abortion? It is simply the expulsion of the product of conception before the age of viability, or simply the loss of pregnancy before the age of viability. In the US, you may define it as loss of pregnancy or termination of pregnancy before the age of 20 weeks of pregnancy. In the UK, it could be seen as the loss of pregnancy before the age of 24 weeks of pregnancy. Of course, abortion can be divided into two. We have the one we call spontaneous and the one we call induced abortion. Spontaneous abortion, where it occurs by itself, and the spontaneous abortion is also what is called miscarriage, because no one interferes. It just took place all by itself. Now, but for induced abortion, you are involved or someone else is involved. Someone is involved in the termination of pregnancy. That's why it is called induced abortion. And now it is done either medically or surgically. So I would concern myself with the medical method of abortion. What are the drugs that can be used for this procedure? Basically, there are two drugs that must be taken in combination. The first is mifeprostone. Mifeprostone is taken orally, and the other one is misoprostol. That one can be taken vaginally. In other words, it can be injected, or you can also take it through the mouth, but not by swallowing it. You can put it under the tongue or between the teeth and the gum. So that's how you take the misoprostol. But for mifeprostone, you swallow it, and then with water orally. You take that orally. And then, but the first drug you take should be the mifeprostone. That must be taken first, and then after 24 hours you can now take the misoprostol. And then when you are finished taking this, what you expect to see is bleeding. That bleeding, of course, will be heavier than your normal menstrual bleeding. Of course, if it is very severe, please take note. If it's very, very severe, you have to contact your healthcare giver, which is why I said you must do this under the supervision of a health professional. Then, if you may also have fever, but if that fever exceeds 24 hours, run to your medical practitioner. Again, you may have abdominal pain. If that abdominal pain defy any drugs analgesic, again run toward your healthcare giver. You see, so these are the main symptoms you may see. Again, sometimes some people may have vomiting, they may have diarrhea. If these symptoms are very severe, again, please do not fail to run to your healthcare giver. And now, even if you do not observe, even if everything works well, you still need to go to see your healthcare giver, because he has to be sure that there is no ongoing pregnancy. That it's possible for you to have taken these drugs. At the end of the day, the procedure may fail. The pregnancy may still be going on. So there is need for you to still see your healthcare giver, who will do examination on you to be sure that the procedure was satisfactory. There are conditions that may not allow you to carry out abortion by the use of drugs. Of course, we say this is medication abortion. There are conditions that would not allow for medication abortion. One is that if the pregnancy is above 7 weeks, I've said it, if the pregnancy is above 7 weeks, Just don't know that this cannot be done. You cannot end that pregnancy with what? Drugs. Secondly, if the woman has medical conditions that such as bleeding disorders, when there is bleeding, if the woman has bleeding disorders, that this abortion termination by this method shouldn't be carried out, shouldn't be done. Then another reason for why you don't have to do this is if the woman is react to these drugs. Those two drugs I've mentioned. If the woman react to them, you're not supposed to do this method of what? Pregnancy termination. Also, if the woman knows she will not be able to go back to her healthcare professional, there is no point doing this, because something may go wrong. For instance, there could be incomplete abortion, and if there is incomplete abortion, which means that everything that has not come out, and so there will be heavy bleeding. So that you need to, in that case, you need to see a healthcare provider, for which we say that if there is no accessibility to a healthcare provider, that woman should not carry out this procedure. Very, very important. The woman shouldn't carry out this procedure, shouldn't begin to take the drugs. Again, if there is evidence of what we call ectopic pregnancy, that's to say the pregnancy is not in the uterus. Once the pregnancy is not in the uterus, please, this method of abortion shouldn't be done. It should not be done. The reason is this: if the pregnancy is outside the uterus, remember that the drugs that are taken are mifeprostone and misoprostol. And mifeprostone action, its own action is to block the action of progesterone. Progesterone is the hormone that keeps pregnancy. It is the hormone that makes the pregnancy to stay, to grow to 9 months. Now, so what this mifeprostone does is to block the action of that hormone. And then the other drug is misoprostol, also known as cytotec. What misoprostol does is to cause uterine contraction. In other words, it causes a contraction of the muscle of the uterus. And so that's the kind of contraction you see during menses. And so there is that uterine contraction together with the blocking of the progesterone hormone, and that will push the fetus out, and you will now have that pregnancy aborted. So if it means that the action of these drugs is on the uterus. So on the event where the pregnancy is not in the uterus, it's outside the uterus, that's ectopic pregnancy. If the pregnancy is outside the uterus and then you give that drug, of course there will be no result. That pregnancy cannot be removed, because those drugs can only act in the uterus. They cannot act, because supposing the woman, the pregnancy is at the fallopian tube, what we call tubal pregnancy. So that drugs cannot go to the tubes to act. They will act within the uterus, and so the whole idea will not be successful. So it is good that if there is evidence that the woman has a ectopic pregnancy, then this procedure cannot be done. For which we say the woman must be under the supervision of a medical practitioner or a healthcare giver, because these are the people that can actually find out if these things I've mentioned, whether there is a ectopic pregnancy or not. But for you, the woman, you won't be able to detect or determine if the pregnancy that you have is ectopic. You see the reason why we say medical abortion or medication abortion should be done strictly under the supervision of what? A medical practitioner. I want to believe you have understanding of what I have told you. So in case you have any question, in case you have any comment, please drop them at the comment section. Also, do not fail to hit the subscription button, share this video, like it, and again, turn on your notification bell. Thank you.